Hi, my name is Shelley Nehmen, and I'm a dietitian working at the Digestive Health Center at the University of Maryland Medical Center. I've been asked to speak with you about nutrition and diet and inflammatory bowel disease. As we only have a few minutes together, let's focus on some of the highlights of nutrition care. Your nutrition making decisions will very much depend on where you're at with the disease. When the disease is flaring and you're feeling poorly, there may be special considerations with your nutrition. Malnutrition, for example, can affect up to 85% of patients hospitalized with inflammatory bowel disease, or even up to 30% as an outpatient. It can affect your immune system, lead to worse inflammation and worse disease outcomes, such as more hospitalizations or more surgery. It's important to be aware of the signs of malnutrition so you can report this back to your provider. Some examples are loss of appetite, unintentional weight loss, fat or muscle wasting, fatigue, loss of concentration, impaired immunity, and impaired wound healing, to name a few. Malnutrition may occur during a flare if you're having difficulty tolerating foods due to your GI symptoms. It's also important to note that malnutrition can happen at any body size. Far too often, those that are overweight or obese may not recognize that significant weight loss is not desirable. So to reduce the risk of malnutrition, you may need to alter your diet. If you're experiencing increased GI symptoms, such as abdominal pain and/or diarrhea, you may want to try a diet that's lower in fat, fiber, caffeine, spicy food, sugar, and alcohol. This may help you to lessen your symptoms, which may also allow you to eat more food. If you have a stricture or recently had surgery, you may also want to have a diet that's lower in fiber content. Hydration is important no matter whether you're in a flare or not in a flare, but if you're having increased GI losses, you may also want to start to include some oral rehydration beverages. Being creative with your dietary choices may be necessary to help you get the adequate calories and protein you need to help support your body during this stressful time. You may want to try eating smaller, more frequent meals and snacks. You may need to include some nutritional supplement shakes or maybe even powders. You may want to try adding protein every time that you eat or have a snack. Some of these strategies may help to improve your overall nutrition. There are also many diets that are available if you've ever done a quick Google search, many diets available for inflammatory bowel disease. Although no specific diet has been proven to cure inflammatory bowel disease, there are different diets that may be beneficial to help reduce symptoms or even the severity of a flare or maybe even inflammation. Some examples of those diets may be the specific carbohydrate diet, exclusive enteral nutrition, the Crohn's disease exclusion diet, the IBD anti-inflammatory or AID diet, the Mediterranean diet, or even the low FODMAP diet, or even just gluten-free. So you can see there's a variety of different diets that are available with different levels of support in the literature. Some of these diets include elimination diets, and following these diets, you always want to talk to your provider before you follow these diets, as some of them may lead to unnecessary calorie or protein restriction, which may in turn increase your risk of malnutrition. So it's always a good idea to talk to a provider or to your dietitian about any of these diets you'd like to try, so that we can help you to make sure they're nutritionally adequate while you're trying them. There may be times during the disease that you may have different micronutrient requirements. You may require iron at different times, possibly vitamin B12, vitamin D, calcium, or other fat-soluble vitamins. Your provider will monitor your levels of these different vitamins, and if deficiency is detected, you may be asked to have repletion of those vitamins. Of course, having an adequate diet may also help to keep your vitamin and mineral levels at proper levels while you're eating. So that can be helpful as well. Even when you are healthy and without disease activity, nutrition can play a vital role in the disease. You do want to, as you feel better, to reintroduce healthy foods back into your diet as much as your body will allow you to. You do also want to try to have as anti inflammatory of a diet and lifestyle as you can. And this may mean following more of a Mediterranean diet and lifestyle, or again, being as healthy as you possibly can. Lastly, if you know that you're experiencing food intolerances or sensitivities, working with a dietitian can help you to discover what particular issues you may have. There may be various tools that you may use with the dietitian, such as elimination diets or food diaries. But again, it's important that you discuss this with your provider or your dietitian, as eliminating foods or food groups on your own long term may also lead to specific nutrition deficiencies or even to malnutrition. So, in closing, nutrition can be complex when it comes to inflammatory bowel disease. Your nutrition considerations may vary at different points of the disease, but it's important that you always be mindful to try to eat as healthy as your body will allow to maintain a healthy body weight. And partnering with a dietitian can be beneficial to help guide you on your nutrition journey. Thank you so much for your time today.